Hi everyone, my name is Aloma Spencer Johnson, and I'm here to present a community health needs assessment conducted in the Mott Haven and Melrose section on the Bronx on one of their priority health issues, childhood asthma. To conduct this assessment, I used the Precede Proceed model framework. This model is a roadmap, and its evidence-based approach can provide a basic structure for planning behavior change programs. The model in phase one, it has the ability to identify the ultimate outcomes, and in phase two, it identifies the issues and sets priorities among the community. Also in phase two, it looks at the issues and the behavioral and environmental determinants, thus giving results promoting health in the community. As we look at the model here applicable to the Mott Haven Melrose community, in phase one of the social assessment, we look at the quality of life to improve access to healthcare services for children in the community, partner with stakeholders to increase awareness of health and social issues affecting the community. In phase two, the epidemiological assessment, we look at the health. Some families lack funds to purchase appropriate items for children's care and development. In phase three, the behavioral and environmental assessment focuses on the behavior and lifestyle and the environment. Now, low-income families do not always have access to healthy food choices as those in affluent neighborhoods. And some families do not seek routine medical care because of lack of health insurance. As we look at the environment, Mott Haven, the built-up community, has limited access to fresh foods. In phase four, the educational and ecological assessment, we look at the predisposing factors, the reinforcing factors, and the enabling factors. For the predisposing factors, this is an immigrant community which consists of Caribbean, West African, and South American descendants. Reinforcing factors, we will educate stakeholders and providers on how to address children's health and development. And another enabling factor is a year-round Grow NYC fruits and vegetable program, which provides fresh fruits and vegetables for families. And in phase five, the administrative and policy assessment, one of the goals will be to promote clean air initiative, educate the community and industries on the importance of clean air, and the distribution of vouchers for fresh fruits and vegetables to families. As we look at the physical environment of this community, we see here where the community is made up of tall buildings, tall apartment buildings. This is the southernmost part of the borough, the Bronx, New York. It's a low-income minority community which is rich in history and culture. There's subsidized and public housing. There are major subway lines. It's a high traffic zone, and it's also home to the famous Yankee Stadium. Some of the challenges in this area includes new developments, manufacturers, and lack of fresh farm markets. As we look at the demographics of this community, the total population of the Bronx is approximately 1.5 million, while in Mott Haven and Melrose, there are 94,377 that makes up the population. The median age for females is 33.1 and for males is 27.6. The median household income in the Bronx is 34,000. However, in the Mott Haven and Melrose section, the median household income is 9.5 thousand. Here we look at some socio-economic indicators which can contribute to this health issue of asthma. The income, the families in this area live below the federal poverty line. In terms of education, their education level is lower than the city's average, and housing, mostly apartment buildings with limited area for exercise. in terms of their health care, which is very important to this neighborhood. There are disparities observed in health care compared to other boroughs in New York City. In conducting this needs assessment, I looked at the priority health issues affecting this community, and two of those issues are air pollution and childhood asthma hospitalizations. When we look at the air pollution, Mott Haven has a 10.0 micrograms of fine particulate matter per cubic meter compared to the rest of New York City, which has 8.6 micrograms, the Bronx, the rest of the Bronx, 9.1 micrograms, and the Rockaway and Broad Channel, New York, 7.6 micrograms. So we see here that the Mott Haven and Melrose section ranks number 11 for the air pollution in New York City. In looking at the childhood asthma hospitalizations per 10,000 children ages 5 to 14, Mott Haven and Melrose ranks number 1 with 112 hospitalizations per 10,000. Borough Park, New York ranks number 59 with 6 hospitalizations per 10,000. The rest of the Bronx, we have 72 hospitalizations, and the rest of New York City, an average of 36 hospitalizations. So we see here that the Mott Haven section, there's an alarming rate at 112 versus 6 in another part of New York City. Therefore, we see where this is a priority health issues for the residents of this community and their children. Between 2013 and 2014, the asthma trend was observed by the New York City Automated School Records for public school children ages 5 to 14 years with asthma. Looking at this trend, Staten Island, which is the lowest line, the lowest blue line, Brooklyn, which is the lowest blue line, their asthma rates increased in 2012, and it shows that in 2014 that it's increasing as well. While we look at comparing it to the Bronx, in 2010, the asthma hospitalization rate was approximately, let's say, 75 per thousand to 2014, where it rose to approximately 100 per thousand. So looking at the Bronx compared to Brooklyn, Manhattan, Queens, Staten Island, and the rest of New York City, the Bronx is rising above the rest in terms of public school children with asthma during this time period. These are some of the childhood asthma risk factors that contributes to this condition. We look here at the socioeconomic status. Hispanic families in the Bronx have a higher percentage of children with asthma. So we look at the ethnicity. The family history of asthma could also be a risk factor. A history of infections, another risk factor. And looking at the pollutants, exposure to air pollution, tobacco smoke, household roaches, and mold are all conditions that trigger asthma in children. Because of the alarming rate of asthma in the Bronx, there have been several partnerships working together to combat this problem, to make children's life healthier and improve on the quality of air they breathe. Some of these partnerships include the Bronx Smoke-Free Partnership, the South Bronx Asthma Partnership. Their logo is Helping the South Bronx Breathe Easy, and the Institute for Family Health. Now, with the collaboration of these partnerships, it is the hope that New York City will show a decrease in children with asthma conditions in the Bronx. Some of the key findings from this community health needs assessment in Mott Haven and Melrose include the childhood hospitalization rate in Mott Haven and Melrose community is 14 times higher than those living in New York City's financial district. The highest asthma hospitalization rates occur in this neighborhood among children 5 to 14 years, which is twice the citywide rate. 45% of adults in this area do not have a high school diploma, and it comprises of the lowest percentage of people who have a college degree in New York City. Childhood emergency room visits accounts for 112 per 100,000 in children 5 to 14 years of age, and 42.7% of children in the Bronx live below the poverty line compared to the rest of New York City, 21.7%. Looking at these findings, we see here that the Mott Haven and Melrose section of the Bronx needs help to improve conditions, their living conditions, their air quality for children, and in doing this, it's the hope that there will be a decrease in the asthma hospitalization rates and the asthma incident rates among children. Some of the references for the information provided in this health need assessment, they came from the United States Census, the Mott Haven, New York Statistical Atlas, the city data, the poverty data for the Bronx, the Bronx Community Health Profiles conducted in 2015 in the Bronx Community District 1, and the New York State Asthma Surveillance Report. Thank you for listening.